Drug abuse is excessive use of drugs for non-medical purposes, despite the social, psychological, and physical problems that may arise from such use.
We chose this topic because we belong to Pakistan, where every day 700 people die due to drug abuse, which is a very alarming and concerning number.
And our mission is to reduce that number as low as possible.
Drug abuse is the repeated and excessive use of drugs. It impacts a person's mental as well as physical health negatively, causing a major damage to the brain. Drug abuse is an important rising global issue. According to World Drug Report 2023, there were approximately 296 million drug abusers in 2021, which is a 23% increase since 2011. Unfortunately, Pakistan is also one of the countries affected by this problem. Pakistan has a 6.7 million population of drug abusers apart from alcohol and tobacco. This is 6% of the total population, 9% of the adult male population, and 2.9% of the adult female population. There are multiple causes of drug abuse, and the main ones, according to our survey, are peer pressure, family problems, and mental health issues. Peer pressure is a powerful influence, and it can lead individuals to engage in drug use in their quest to fit in with friends. According to surveys, around 30% of teenagers report feeling pressured by their peers to try drugs or alcohol. Additionally, studies suggest that adolescents who have friends involved in substance abuse are more likely to experiment with drugs themselves. Pressure to conform to social norms can be intense, with approximately 70% of teenagers indicating that they have been offered drugs by their peers. These statistics highlight the prevalence of peer pressure influencing drug-related behaviors among young people. It's crucial to address this issue through education and support systems to empower individuals to make informed and independent choices. Family problems significantly contribute to drug abuse, with various factors playing a role in this complex relationship. According to national surveys, individuals from families experiencing high levels of conflict or dysfunction are more than twice as likely to engage in substance abuse compared to those from stable family environments. Research also highlights the impact of parental substance abuse, revealing that children of parents with substance use disorders are at a significantly higher risk of developing similar issues themselves. In households where there is a lack of emotional support or where communication breakdowns occur, individuals may turn to drugs as a way to cope with stress and emotional pain. Studies indicate that adolescents from families with strained relationships or inadequate support systems are more prone to experimentation with drugs. These statistics underscore the importance of addressing family dynamics and providing support services to mitigate the risk factors associated with drug abuse within the family context. Mental health problems can significantly increase the risk of drug abuse, creating a challenging interplay between psychological well-being and substance use. National surveys reveal that individuals with mental health disorders are twice as likely to have a substance use disorder compared to the general population. Specifically, about 20% of adults with a mental health disorder also experience a substance use disorder. Moreover, the prevalence of co-occurring disorders is even higher among certain populations, such as individuals with post-traumatic stress disorder (PTSD) or bipolar disorder. Research underscores the link between self-medication and mental health issues, indicating that nearly one-third of individuals with a mental health disorder misuse substance as a way to cope with their symptoms. These statistics highlight the urgent need for integrated approaches to mental health and substance abuse treatment, recognizing the complex relationship between the two and addressing both aspects concurrently for effective and sustainable recovery. Early intervention and support for mental health can play a crucial role in preventing the onset of substance abuse or mitigating its escalation. We also conducted interviews with victims of drug abuse, and these were the causes of their addiction.
दूसरी बात ये ड्रग लेने की वजह मेरे ट्रॉमास थे बचपन के।
तो ये जो एडिक्शन थी आपकी, इसके स्टार्ट होने की क्या वजह थी?
ये मैं शौक में ऐसी करने लगी, दोस्तों के साथ बैठ के शौक में किया बस।
Drug abuse has severe consequences which can even lead to death. The main consequences of drug abuse are mental health problems, family problems, and loss of future productivity. Drug abuse is closely linked to a heightened risk of mental health issues, contributing to a complex interplay between substance use and psychological well-being. National surveys indicate that individuals grappling with substance use disorders are about twice as likely to experience mood and anxiety disorders compared to the general population. For example, approximately 8.1 million adults in the United States had both a mental health disorder and a substance use disorder in 2020. Substance abuse, particularly involving substances like opioids and methamphetamine, has been associated with an increased prevalence of depression and psychosis. Moreover, the risk of suicide is substantially elevated among those with substance use disorders, with nearly 30% of suicide deaths involving individuals with a known substance abuse treatment, highlighting the importance of addressing both aspects concurrently to achieve comprehensive and sustainable recovery. Early intervention and access to mental health services are critical for breaking the cycle of co-occurring disorders and promoting overall well-being. Drug abuse can have pervasive and damaging effects on families, with statistics highlighting the extent of the challenges faced by households dealing with substance abuse issues. According to the Substance Abuse and Mental Health Services Administration, in 2020, an estimated 7.7 million children in the United States lived with at least one parent with a substance use disorder. This statistic underscores the widespread impact of drug abuse on family dynamics. Furthermore, the National Survey on Drug Use and Health reported that in the same year, about 1 in 8 adults aged 18 and older lived in households where at least one member had a substance use disorder. The financial toll of drug abuse is evident, with a substantial portion of family income diverted to support the addiction. Studies indicate that families dealing with substance abuse are more likely to experience financial instability with economic strain. These statistics underscore the urgent need for comprehensive support systems, including counseling and intervention services. These statistics underscore the urgent need for comprehensive support systems, including counseling and intervention services, to address the multifaceted challenges that families face due to drug abuse. Early intervention is crucial to mitigate the long-term consequences and promote healthier family environments. Drug abuse exacts a substantial toll on future productivity, as evidenced by concerning statistics that highlight the widespread impact on education, employment, and overall economic contributions. According to the Substance Abuse and Mental Health Services Administration, in 2020, approximately 10.1 million adults aged 18 to 25 in the United States reported past month illicit drug use. This prevalence among young adults, a crucial demographic for workforce entry and education, underscores the potential long-term consequences on future productivity. Moreover, the National Survey on Drug Use and Health reveals that substance abuse has been associated with higher rates of unemployment, with individuals aged 18 and older reporting illicit drug use having a lower employment rate, which is 58.2%, compared to those who did not use drugs, 71.1%. The economic burden is substantial, with the cost of lost productivity due to substance abuse estimated at over $120 billion annually. These statistics emphasize the urgent need for comprehensive prevention and intervention strategies to address the multifaceted challenges posed by drug abuse, safeguarding the future productivity and potential of individuals and society at large. Early intervention and access to effective treatment are pivotal in reversing the negative impact on productivity and fostering healthier, more productive futures. These were the consequences faced by the victims of drug addiction.
तो ये जब इन आदतों में पड़े, अब तो अल्हम्दुलिल्लाह आप बाहर हैं, लेकिन जब आप इन आदतों में पड़े थे तो सबसे बड़ा अफेक्ट क्या था आपकी जिंदगी पे, इसका असर क्या आया था?
बहुत कमज़ोर हो गया था मैं। बाहर जब निकलता था घर से कोई इज्जत नहीं करता था, सब बोलते थे नशे का मरीज है, नशे का ये, और नीचे इधर उधर कोई मेरे साथ नहीं बैठता था, मेरे अच्छे दोस्त मेरे साथ नहीं बैठते थे, बहुत गंदे कपड़ों में घूम रहा होता था, बहुत हालत ख़राब होती थी।
आपके दोस्त वगैरह थे, सोशल लाइफ थी आपकी, वो कैसे उसमें इफेक्ट हुई?
सोशल लाइफ मेरी इफेक्ट ऐसे हुई कि शुरू में तो बहुत सारी गैदरिंग्स पार्टीज़ वगैरह में मैं जाना शुरू हुआ, मतलब एक जॉइंट उसमें रहता था मैं, फ्रेंड्स वगैरह में बहुत सोशली मेरी एक्टिविटीज़ बहुत सारी थी, फेसबुक वगैरह, दोस्तों में आना जाना, बाहर की आउटिंग। लेकिन जूं मैं इस नशे में आगे बढ़ता गया, इस दलदल में फंसता गया और नीचे ही जाता गया, तो सारी चीज़ें ख़त्म हो गई। मेरी सेल्फ स्टीम मेरी बिल्कुल ख़त्म हो गई, लोगों से कट गया, सबसे पहले अपने घर वालों से कट गया, एक कमरे में बंद रहने लगा, तो बहुत ज़्यादा इफेक्ट हुई इस चीज़ से।
Addressing drug abuse requires a multifaceted approach that combines prevention, treatment, and support services. Prevention efforts can be strengthened through educational programs and community initiatives that raise awareness about the risk of drug abuse. According to the National Institute on Drug Abuse, for every dollar invested in prevention programs, there can be a savings of up to $10 in treatment costs. Access to evidence-based treatment is crucial, and statistics emphasize its effectiveness. In 2020, about 15.4 million individuals aged 12 and older in the United States needed substance use treatment, but only 7.9% received it. Increasing access to treatment can lead to positive outcomes, as individuals who receive proper care are more likely to achieve sustained recovery. Additionally, ongoing support services, including counseling, mental health care, and support groups, play a vital role in preventing relapse and promoting long-term recovery. A comprehensive and integrated approach supported by statistics is essential to effectively combat drug abuse and its associated societal costs. We interviewed the psychologist at Promise Rehabilitation Center, and this was her opinion on the solution.
बिल्कुल ऐसा ही
आपका
है।
मैसेज क्या होगा यंग जनरेशन के लिए और पेरेंट्स के लिए स्पेसिफिकली कि जो अगर जिनका बेटा बेटी इस बीमारी में मुब्तला हो जाए तो उनके लिए आप क्या मैसेज देना चाहेंगे?
मेरा मैसेज यही है कि आप बातचीत क्या करें, अपने बच्चों से बातचीत करें, उनसे पूछें। ज़रूरी नहीं कि हर दफ़ा हर चीज़ रोक टोक से चीज़ें सही हो जाएंगी। आप कम्युनिकेट करें, उनसे डेली रूटीन के हवाले से पूछें। ऐसा नहीं कि ज़बरदस्ती बिठा के पूछ लिया। तो हेल्दी कन्वर्जेशंस रखें, डाइनिंग पे रखें। स्पेशली मदर्स अपने बेटों को इंगेज करें, अपने साथ एक्टिविटीज़ में इन्वॉल्व करें। सिर्फ जो है वो लड़कियों के काम नहीं होते, घर के काम लड़कों को भी इन्वॉल्व करना चाहिए, ताकि उनको पता चले कि हाँ रिस्पॉन्सिबिलिटी इक्वल है, दोनों तरफ है। ऐसा नहीं कि सिर्फ एक तरफ से चीज़ें चलेंगी। जिस तरह आपके फादर जो है वो फाइनेंशियल रिस्पॉन्सिबिलिटी लेते हैं, तो मदर भी तो रिस्पॉन्सिबिलिटी ले रही है ना घर की। तो दोनों को आपस में एक हेल्दी माहौल रखें, बच्चों से बातचीत करें। उनकी गैदरिंग्स को ये नहीं कि उनको पिन पॉइंट करते रहें कि नहीं कहाँ जा रहा हूँ, कहाँ बैठ रहा हूँ। फ्री देना चाहिए। एक अच्छी पेरेंटिंग का कोई रूल नहीं होता, मतलब आपने एक जो है किसी रूल या किसी बुक के साथ तो पेरेंटिंग होगी नहीं। जो एक्सपीरियंसेस आप सीखते आ रहे हो उसी से ही सीखते चलोगे।
These are some suggestions that people notice to prevent drug abuse in the country. Unfortunately, there is no support from the government to Promise Rehab Center and is running its operations through anonymous donations and only the fee charged by them.
ये जो आपका रिहैब सेंटर है, इसमें आपको गवर्नमेंट की तरफ से कोई फंडिंग या कोई सपोर्ट मिलती है इसको चलाने के लिए?
नहीं।
तो फिर ये आपको जो खर्चे वगैरह होते हैं, एक्सपेंसेस, आप किस तरह अफोर्ड करते हैं?
बस ये कहूँगा इरफान भाई, अल्लाह पाक पूरा करता है, ठीक है ना। जाहिर है जब एक चीज़ अल्लाह पाक अगर किसी के नसीब में लिखता है तो वसीले भी अल्लाह पाक ही बनाता है ना, ठीक है। हमें खुद नहीं पता कि हमारी चीज़ें किस तरह पूरी होती है। बाकी हैं कुछ ऐसे लोग, ठीक है ना, जो हेल्प करते हैं हमारी फंडिंग के ज़रिए, ठीक है ना, जिसको बोलते हैं ना जो अल्लाह वाले लोग होते हैं, ठीक है। तो इस तरह की हमारी हेल्पिंग इंशाल्लाह हो ही जाती है, जिस तरह हमारा इदारा इंशाल्लाह चल रहा है इस तरीके से।
Even though, according to our survey, 53.6% people are highly unsatisfied with the steps taken by the Pakistani government to prevent drug abuse in the country, and it cannot be ignored that a drug abuse rate is rising every day, with drugs being easily accessible locally, but the government is making concerned efforts to address the escalating problem of drug abuse in the country. Collaborating with organizations like UNODC in Pakistan, they are actively raising awareness and working diligently to find effective solutions to combat drug abuse in the country. Now, it is our responsibility to play a vital role as members of society and contribute to supporting both the government and private rehabilitation centers to the best of our abilities. This way, we can work together to ensure the well-being of our future generations and protect them from the dangers of drug abuse.